session. So now I invite ophthalmologist as an expert witness. So we are all can be called as expert witness for court proceedings, either for compensation cases or negligence cases. So how do we take that? It is indeed a challenge because we are used to operation theatre, not the court dynamics. So how do we go about it? What are the challenges and what are our responsibilities in the court of law? I request Dr. Niranjan to talk to us about this aspect. Over to you, Niranjan.
Thank you, sir. Very warm welcome to AIO2025. And at the outset, I would like to thank the scientific committee and Nirmal sir for giving me an opportunity to be a part of this very unique instruction course. So here, today I'm standing before you to talk about the role of an ophthalmologist as an expert witness and its nuances. So anybody in this hall has been an expert witness in the court of law before, has had any experience at all? Because this is a very different ball game. So we come to conferences, we present, and we do have judges for free papers and, but this is completely different, mainly because just like we got used to some very new terminologies the moment we entered the field of ophthalmology, the medico-legal aspects, they themselves have a complete set of terminologies that we need to acquaint ourselves with. So in the previous two talks by Nirmal sir and Satyan sir, you would have come across certain terminologies, right? Like reasonable care and negligence, right? These are very much medico-legal terms that as an expert witness, we should be well versed with in order to be able to understand what the question is being shot at us in the court of law and to be able to reply aptly, right? So an ophthalmologist, like we discussed, is expected to be multidimensional, and as an expert witness needs to have adequate knowledge beyond the routine syllabus of ophthalmology. So as an expert witness, or I would say as a medico-legal cum medical expert, our role as an expert mainly can be broadly classified into these three categories of claims of compensation, claims of benefits in view of disability, and representing a scientific body to testify in case of negligence. So these are the usual scenarios where one would be expected to speak up in the court of law. So starting with the first one, that is the claim of compensation. So this is usually the scenario of having to encounter ocular injuries that happen at workplace. And as medical experts, we are expected to establish a causal relationship with the implicated injury. So whether the injury that has happened is directly because of the incident that is being incriminated. And also we are required to determine the severity of the injury, which is crucial for the degree of damage that has happened following the injury, right? So there was this article which spoke about the clinical profile of various medico-legal cases presenting to a tertiary eye care hospital in India. And among that, as you can see in the bottom of the screen, around 3% to 5% of the injuries tend to happen in the workplace, that is a place which everybody visits on a daily basis. When we talk about injuries like road traffic accidents, yes, you can call them accidents, but these also are accidents which are happening at a place very commonly visited on a day-to-day basis. So what is the act that comes into picture is the Employee Compensation Act. So it is important to deem the percentage of loss of the earning capacity that the person has to suffer because of the injury that is being discussed. And as I've highlighted here, point number 4 is loss of sight to such an extent as to render the claimant unable to perform any work for which eyesight is essential. So this is where we come into the play, and we are expected to expertly opine on the percentage of loss of earning capacity after thorough evaluation. Then moving on to claims for disability benefits. So it is expected of us to evaluate the plaintiff and provide appropriate certification of disability as per the Government of India guidelines. And there is a concept of benchmark disability. This is very important for us to know, which is amounting up to 40% of disability, which is being provided with certain exclusive benefits and quotas for occupations in the government sector. So this is often beneficial to people who are having other challenges to face with in their daily life. So this is the Rights of Persons with Disabilities Act 2016, that is RPWD Act. And this speaks about two important areas which is of concern to us. One is The less common one, that is a physical disability, where there is difficulty due to loss of sensation and paresis in the eye and eyelid, but with no manifest deformity. And the second is the more commonly encountered one of visual impairment, where it has been broadly classified into blindness and low vision. So blindness refers to total absence of light or visual acuity less than 3/60 or less than 10/200 in Snellen's chart in the better eye with the best possible correction. Low vision, on the other hand, means visual acuity not exceeding 6/18 or less than 20/60 up to 3/60 or up to 10/200 in the better eye with the best possible correction. And not to forget the part of limitation of field of vision. Now, one may have a relatively good vision in the center with 6/6 also, but limitation of field of vision too counts as disability, and that is explained as limitation of field of vision subtending an angle of less than 40 degrees up to 10 degrees. Okay, so these are two areas where the plaintiff has a claim, either as a compensation or as a disability. Now we move on to a whole new scenario where we are expected to testify in cases of medical negligence, right? So first is the scenario of where there is an alleged negligence by a colleague or a doctor who's incriminated during either the negligence having been conducted during evaluation or treatment. So the expectation from our side is to opine on the legitimacy of reasonable conduct. So this is what I was referring to you as terminologies, right? So whether a knowledgeable doctor would have acted in a similar way if being faced with a similar situation is what we need to opine on. So there are certain redressal commissions like Consumer Dispute Redressal Commission, and it is important to note that a significant proportion of the consumer complaints that are being lodged are related to ophthalmology as well, right? So the even more interesting part about this is about 73.3% of those which have been lodged have actually been successful in getting their claims, which means to say that we really need to work on being more medico-legally fit in order to avoid such cases. So this was mentioned very well in the article that I've cited here, increasing cases of litigation against ophthalmologists. So what are the qualifications that one must have in order to be an expert witness? First and foremost is to hold a valid current license to practice medicine and in specific ophthalmology. He or she shall not misrepresent his or her credentials, qualifications or experience, and also be knowledgeable about the standard of care with the latest scientific evidence. And how do you perform as a proper witness in the court of law? First and foremost is reaching court on time. This is often understated because in our busy schedules we may end up creating a wrong impression, first impression with the court of law. Ask for the records of the case and try to spend some time studying it. Revisit the medical report that you have submitted from your side as a part of the evaluation process, and bring along an office staff from the court of law if there is a remote location that we are talking about in the court of law. And also very important to tackle a lawyer and his interrogation. There could be intimidating questions from the lawyer, and it's essential for us to deal with it with calmness and composure, and we should not be very overwhelmed when we are disregarded or cross-questioned, because that's how the court of law works. And it's essential for us to be polite and and to be expecting some amount of sarcasm and rudeness, because lawyers are quite capable of pulling it off. And lastly, during cross-examination, you may be expected to say yes or no only, but it is not wrong on your part to justify or take the liberty to explain or add what you want to say. Also intimate the judge if there is some amount of misinterpretation of your reports that you have submitted. And last but not the least, refrain from opining beyond your area of expertise. So what is the groundwork to do to be a good expert witness? Make sure you maintain good clinical records, medico-legal records of treatment done before the patient visits you and while in your care. And this helps in establishing continuity of treatment. Documentation to be recorded systematically, and remember that the facts are in the details. So do not miss out on the intricate details of examination while you're examining the person in question. Legible handwriting, specific findings in the right terminologies, and try to include more diagrams. Even simple line diagram speaks a lot in the court of law, because that shows that you have taken enough efforts to document what you're seeing. And certain advocacy measures which may be beneficial are to include a separate section in the syllabus of post-graduation about these medico-legal aspects, as there is very little knowledge imparted to us in our undergraduation in the subject of forensic medicine. And lastly, having bridging instruction courses like these in conferences to fill the gaps of lack of knowledge or lacunae of knowledge in these arenas. So the take-home message, both the right skill set and mindset are two prongs of an expert witness. Knowing beyond your subject is good, but try to stay within your field. Beware of your do's and don'ts in the court of law. Meticulous background work in your workplace is mandatory to perform on the D-Day. And lastly, keep updating yourself with recent advances.